Okay, let's talk about something I hope you never, ever have to use. We're going to walk through how to perform CPR on a dog. I know it's a really serious topic, but knowing these steps could genuinely empower you to act in a critical moment.
Just imagine it for a second. I know, it's every pet owner's worst nightmare. Your best friend is unresponsive. In that moment, there's panic, confusion, and just fear. The clock is ticking, and every single second counts. So, what's the first thing you do?
That's what this guide is all about. It's designed to be your lifeline to help you cut through that sheer panic. It gives you a clear plan of action, a vital bridge to get you to professional veterinary help.
So first things first, we have to figure out exactly when this pretty extreme measure is actually necessary. See, doing CPR at the wrong time can be dangerous, so knowing the right signs is absolutely critical.
And listen, this is probably the single most important rule of all. CPR is a major intervention. It's for when the body's most basic systems have completely shut down. If you do this on a dog that's still breathing or has a heartbeat, you could cause serious harm. This is the absolute last resort.
Okay, so before you jump in and do anything, you have to assess the situation, and you've got to do it fast and accurately. This brings us to the critical check.
All right, you're at a huge decision point here. So look at these two columns. If your dog is unconscious, isn't breathing, has no heartbeat, and you notice their gums are pale, blue, or even gray, those are your signals. That's when you start CPR. But, and this is super important, if they are breathing or you can feel a pulse, do not start CPR. Your only job in that case is to get them to an emergency vet, immediately.
So the check itself is a simple three-step process. Step 1, look for the rise and fall of their chest. Step 2, feel for a heartbeat. Just place your hand on their chest, right behind their left elbow. Anything? And step 3, gently open their mouth and check if anything is blocking their airway. If you've got no breathing, no pulse, and the airway is clear, it's time to begin.
Now that we've confirmed CPR is absolutely necessary, let's walk through the exact procedure step by step.
Positioning is key. It's everything for the compressions to be effective. You need to get your dog onto a hard floor, not a soft bed or a couch, and lay them on their right side. This puts their heart in just the right position for the next step.
The first number you need to burn into your brain is 30. You're going to start with a cycle of 30 chest compressions.
The technique here is very specific. Place your hands on the widest part of their chest. Your goal is to compress it to about 1/3 or maybe 1/2 of its normal depth. And the rate is crucial too. You're aiming for about 100 to 120 compressions per minute. You know, a helpful trick is to match the rhythm of the song Staying Alive. Yep, the same one they teach for human CPR. After those 30 compressions, you move to the second part of the cycle. And the next number to remember? It's 2 rescue breaths. Now, this is different from human CPR. You're going to gently hold their mouth closed with your hands and then form a seal with your mouth over their nose. Give 2 breaths, just strong enough to see their chest visibly rise. Not too hard, just enough to see that movement.
So this is the rhythm. It's a continuous cycle. 30 compressions, then 2 breaths. 30 compressions, 2 breaths. You just repeat this without stopping, over and over.
Now, as any dog person knows, our buddies come in all shapes and sizes, which means, yeah, you might need to adjust your technique. For breeds with those very round, barrel-shaped chests, like bulldogs or pugs, laying them on their side just isn't effective. For them, you'll actually position them on their back and do the compressions directly on their breastbone, their sternum, just like you would for a human. And for dogs on the opposite end of the spectrum with very deep, narrow chests, think greyhounds or Dobermans, you'll keep them on their right side, but instead of compressing the widest part of the chest, you'll want to focus your compressions directly over the heart itself. It's so vital to remember the ultimate goal here. Performing CPR isn't the final step, it's a temporary measure. Think of it as the bridge that gets your dog to professional help.
So you just keep going with those 30 to 2 cycles until one of 2 things happens. Your dog miraculously starts breathing on its own, or you arrive at the veterinary clinic and can hand them over to the medical team. Ideally, you have someone else driving so you can continue CPR in the car.
So what can you do right now to prepare? First, seriously consider taking a pet first aid course. Have your vet's number and the nearest 24-hour emergency clinic saved in your phone and posted somewhere visible, like the fridge. Know where that clinic is and the fastest way to get there. In an emergency, believe me, preparation is just as important as the procedure itself.
Look, learning this stuff isn't about dwelling on the worst-case scenario. It's about empowerment. It's about giving yourself the tools to act, to fight for them when they can't. You now have the knowledge to be the lifeline they might one day need.